Hello and welcome to 2-Minute MRCP. Today we'll discuss Brugada syndrome. Brugada syndrome is an inherited cardiovascular disease that may present with sudden cardiac death. It is inherited in an autosomal dominant pattern and has an estimated prevalence of 1 in 5,000 to 10,000 people. It is more common in Asian populations. A large number of genetic variants have been identified in Brugada syndrome. Around 20 to 40% of cases are caused by a mutation in the SCN5A gene, which encodes the myocardial sodium ion channel protein. Mutations in this gene lead to abnormal cardiac sodium channel function, predisposing patients to potentially life-threatening ventricular arrhythmias. Now let's move on to the ECG features. The characteristic ECG finding is convex ST segment elevation of more than 2 mm in one or more of leads V1 to V3, followed by a negative T wave. A partial right bundle branch block is also commonly seen. In some patients, the ECG may appear normal at baseline. In suspected cases, the ECG changes can be unmasked by administering Flecainide or ajmaline. This drug challenge test is the investigation of choice when Brugada syndrome is suspected. Now let's discuss management. Management includes several important general measures. Patients should treat fever promptly, as fever can trigger ventricular arrhythmias. They should avoid excessive alcohol consumption. They should also avoid drugs that may precipitate ventricular arrhythmias. Examples include Flecainide, lithium, and tricyclic antidepressants. Patients at high risk of life-threatening arrhythmias should receive an implantable cardioverter defibrillator, or ICD, which is the definitive treatment for preventing sudden cardiac death. So, when should an ICD be implanted? According to the Heart Rhythm Society and the European Heart Rhythm Association consensus guidelines, there are 3 categories of recommendations. Class 1 recommendations, which represent a definite indication for ICD implantation, include survivors of cardiac arrest and patients with documented spontaneous sustained ventricular tachycardia, whether or not they have experienced syncope. Class 2A recommendations indicate that an ICD should be considered in patients who have a spontaneous type 1 Brugada ECG pattern together with a history of syncope that is thought to be caused by ventricular arrhythmias. Class 2B recommendations suggest that an ICD may be considered in selected patients. This includes individuals with inducible ventricular fibrillation during programmed electrical stimulation and those with high-risk features, such as nocturnal agonal respiration. Thanks for watching 2-Minute MRCP. If you found this helpful, don't forget to like, share, and subscribe to 2-Minute MRCP for more quick revision videos.